This is not a drill. Something actually incredible happened in women's healthcare. For the first time ever, the medical world has officially acknowledged how painful cervical procedures are and outlined how doctors can and should provide pain relief during IUD insertion and other cervical procedures. The new guidelines published by the American College of Obstetricians and Gynecologists, or ACOG, has urged doctors to, quote, not underestimate the pain experienced by their patients. For decades, women have been told that IUD insertion would be a little bit uncomfortable but not painful. That has to be the medical understatement of the century. And this change didn't happen in a vacuum. It came largely because of a surge of social media complaints about the severe lack of pain options. When your medical procedure is going viral for all the wrong reasons, something is clearly off. Before these guidelines, the rhetoric was basically just tough it out, when what patients actually needed was compassion and trust in their providers that they would be believed when they said it hurts. But this delayed recognition of IUD pain reflects a much larger problem. Countless studies have shown that female pain has been historically influenced by both sexism and racism, with healthcare professionals consistently underestimating and undertreating female pain compared to men. And this disparity only increases for women of color. Here's a perfect example of this bias in action. So in 2016, researchers showed 63 pain doctors and medical students identical images of people in pain. The only difference was gender. Then they asked what the appropriate treatment would be. Now listen to this. The doctors gave significantly more medical referrals to the male images and more psychology and psychiatry referrals to the female images. Even though it was identical pain expression, women were more likely to be told that the pain was in their head and that they required therapy rather than actual medical treatment. The incorrect subconscious belief here is that women cannot separate their physical pain from their emotions, while men are presumed to compartmentalize their emotions better and thus can provide a more accurate account of their pain. By the way, if you like this content, I'm doing a deep dive on the science behind IUDs and why historically women's health kind of sucks. That is dropping on our YouTube channel this Thursday, and ladies, trust me, you don't want to miss out on that. And make sure you bring your man for a good education for Women's Health Month this May. Overall, the ACOG guidelines represent real progress, but let's be honest, these guidelines are just the bare minimum of what should have been happening all along. And to be clear, there are plenty of amazing doctors who have been offering pain relief to their patients for decades because the science is crystal clear. Cervical pain is real and significant. Every woman deserves to walk into their medical appointment knowing that their pain will be taken seriously. And honestly, it's about damn time. Am I right, ladies? If you like stories like this and science worth sharing, then give us a follow everywhere at Today Learn Science at TIL Science.